And today I am very excited to welcome Daniel Lettenberger-Klein, CEO of Stella Maris. Stella Maris has seen substantial growth since he joined the nonprofit Addiction Recovery Center in 2019. He has increased staff, led a capital construction project, and opened a 13,000 square foot building that houses an all-gender detoxification center, centralized intake, and a kitchen and cafeteria. He didn't always intend to be in the nonprofit field. When he started college, he was intent on becoming a dentist. But after his first organic chemistry course, however, he knew he needed to pivot and begin looking at psychology and sociology so he could enter more in the helping profession. He holds a Master of Science in Marriage and Family Therapy from Purdue University, a program that only accepts 9 students a year. Originally from Illinois, Daniel has 10 years experience in executive leadership and addiction treatment in Florida and Georgia before settling in Cleveland. He is also a proud recent graduate of the Leadership Cleveland class of 2022. And I see many of his classmates here with us today, and we are happy to have his leadership here in Cleveland. Please welcome Daniel.
Thank you, Rachel, and thank you to the Cleveland Leadership Center for having me. Incredibly honored to be here today, and without the Leadership Center's programming, I wouldn't be as passionate about the business that I'm a part of. I know that that's like a big thing to say, but honestly, there's such pride in, not that I have ownership, it's a nonprofit, but pride and ownership in what I do and investment in what I do. Part of the Leadership Center, what makes them so special is how they help everybody invest in the world around them. And so going through that program, if any of you have an opportunity to go through one of the Leadership Center's programs, I strongly encourage it because it's transformational. So thank you all for joining. Please feel free to ask lots of questions. I won't be watching the chat function, but Rachel will help me towards the end. So I'm just going to do a brief history of Stella and kind of go through it a little bit. Yeah, again, it's kind of, from my perspective, it's really interesting what others find interesting about the work that we do, because it touches so many people so differently, right? Whether there's personal experience, professional experience, distant family experience, whatever that may be, friends, family, mental health and addiction touch nearly everybody, whether we like to admit it or not. So it's really important work. It's an important place, and Stella Maris has a unique place in the history of Cleveland and the history of addiction treatment. Stella Maris has been around since 1948. It's the oldest nonprofit addiction treatment program in Ohio. It is the oldest nonprofit standalone detox program in the US and the oldest nonprofit sober home in the US. Most people don't realize that we have that unique and rich history in our backyard, but the roots of AA are in Akron. I think Founders Day is this weekend. And so there's just a rich history across the region of ties to the foundations of recovery. And so Stella began with just 11 beds for longshoremen coming to dry out. They'd come off the boat, they'd hit the bars up in the flats, on the West Flats in Ohio City, need to dry out before they got back on the ore boats on Monday morning. And that's kind of how it evolved. And detox back then was successive shots of whiskey and a B12 shot to get back on the boat. So it's changed a little bit since then. Today, we are unique in that we're the provider of every level of addiction treatment in one site. So on one block here, we have everything through inpatient withdrawal management, what's called detox, all the way through housing and outpatient services and aftercare service. We work really closely with a lot of other providers. Some of those providers are on here today. And what's a little bit unique but what we do is we operate what's called the therapeutic community. And that is a place where, since our clients, 95% are at or below the poverty line, most require stable, supportive housing to show up for treatment, right? If you have to think about all the things that are unstable in the lives of those struggling with active addiction, housing isn't something always thought about. And for our clients, they can't show up if they don't have a place to stay that they can depend on. And so, I would say over 90% of our clients are living on our campus or adjacent to our campus. And that's what affords them the opportunity to show up every day. And we know more treatment, more consistent treatment for longer periods of time leads to greater levels of success in recovery. And so that's what we do what we can to keep people with us as long as we can. And our mission since 1948 has been to take care of people regardless of their ability to pay. So if they hit the door and we have a bed for them, they're going to get it, and we're going to figure it out, which is a really unique mission to be able to have as well. So before I talk a little bit more about what we do, I thought it'd be interesting to talk a little bit about drugs today and what we're being confronted by and what things have changed over time. 15 years ago, we were starting to see, the opioid epidemic just starting to take shape, with pill mills closing and prescribing going nuts, and opioids being really transforming the pain management sector from like incentive perspective, and the Joint Commission changing pain scales every time you went into the hospital to make sure they addressed pain. It kind of added fuel to this fire of navigating how people were experiencing discomfort. And at the same time, there were significant substances of use and misuse. And so what happened was we had a market flooded with low cost, insurance covered, typically opioid prescriptions, which quickly, for those people struggling with active addiction, can transform into IV heroin use. And today what we have is not as much, at least in our region, not as much IV heroin use. The pandemic actually made it pretty challenging to find pure heroin. What we do have is a flooded market with synthetic opioids. And we here at Stella Maris say we have an entirely tainted drug supply. There is no safe way to use opioids or even some benzodiazepines in our setting. Benzodiazepines are typically anti-anxiety meds and things like that. Opioids are your pain pills typically that you would get. Most people know about heroin or fentanyl, which is all over the place. That's a synthetic opioid. What we have is a drug supply that's been tainted, and it's not strictly within opioid users. So what's unique about right now as well is we see a huge influx of methamphetamine, and clients will come in to our detox. I see our director of nursing on here who oversees our detox. Hey, Carol. We'll see clients come in who report using cocaine, which does not have a physical dependency. It does not have withdrawal symptomology usually associated with it to the point you'd need an inpatient stay. We're seeing clients come into the admissions department in full-blown withdrawal, and they have no idea why, because they've just been using cocaine. And we've heard more and more stories now about how the cocaine's being laced with fentanyl. It's being laced with a lot of different things. They're not just testing positive for fentanyl. There's benzodiazepines in there. There's methamphetamine in there. There's fentanyl in there. And where this community has really stepped up in the last few years is trying to get naloxone into the community, which is an overdose reversal drug, or Narcan into the community to an overdose reversal drug. And we've also tried to get fentanyl test strips into the hands of the community. But it happened just as we were getting to the place where nearly everybody in the active use community that we take care of knows they're taking fentanyl for the most part, unless they're unintentionally taking it by taking another drug. But if you're using opioids, it's not uncommon for them to be seeking out fentanyl, right? You need far less of it to get a far greater high. It's dangerous, but everybody actively using tends to think that they're the expert on actively using and feels a little bit invincible about the dangers associated with it. So where we're seeing overdoses is not just the people who think that they know how to safely use, but it's the unintentional overdose related to people using substances they did not know were tainted. So it's pain pills, anxiety pills, anything bought off the street, it has the potential for being a pressed pill. And that's what we really are trying to caution everybody about, is make sure that the people in your life that are using any medication that they struggle with access to or have been getting from somebody else, make sure they understand the dangers involved. To people like at Ohio State, a few kids died from, I think they thought they were buying Adderall, but it actually was a pressed fentanyl pill. In those situations, a fentanyl test strip would have helped, right? That would have been transformational. But what college kid is thinking, oh, I need to test my Adderall? It's just not the way most people are thinking, and it has to transform. We have to get to that place where we're understanding that safe use doesn't really exist. Doesn't exist right now. And if we want to keep people alive in one of the deadliest years on record, if not one of the most deadly years at the end of this year, we'll see into next year when we get the report, we need to have a different conversation, and we need to change access, and we need to talk about what access looks like. So what Stella Maris is doing about this issue, this pervasive issue that reaches all across our region, east, west, south, we know that we need to make sure that connection is at the forefront of everything. If you look at some other countries and what they've done exceptionally well, it's recognizing that when you have addiction and mental health issues, instinct is isolation, right? Isolation is where addiction thrives, that secrecy, that space. What we lean into here is connection. And that's that therapeutic community that we have that focuses on a self-governance structure for the clients. They're all a part of something the moment that they get here. And because they most live on this campus, it becomes their home, it becomes their family. We take care of, about roughly 100 beds a day. At Stella Maris, we take care of about 3,000, a little over 3,000 clients a year. We're on pace to be able to take care of up to 6,000 clients a year by the end of this calendar year. And the reason why we're growing that way is not because we have a great business plan to make sure that we are in a great revenue position. We're doing it because we know that the community desperately needs it. We have a 130-person wait list just for detox services alone today. And the people that don't get in today have a high likelihood of overdosing and dying and not making it 3 days from now when we might be able to get them in the door. And yes, there are places doing detox in Cleveland other than the region, other than Stella Maris. Where we run into some issues is that some are hospital-based. Some clients don't want to be hospital-based. Some haven't been around for, 74 years. Some haven't been around for 10 years. And there's a lot of places that do really great work. Unfortunately, there's a lot of turf war that has taken place, especially in the nonprofit and addiction treatment space, that has prohibited playing nicely in the sandbox at times to make sure that people get the access they deserve. That I think is ultimately up to the senior leadership at all those organizations to put their egos aside and do the right thing for everybody they're trying to take care of. So the way that we do connection is, is multifaceted. One, having the entire continuum on this block affords the client the opportunity to stay with us long-term and see a path forward and see people in real time that are succeeding at the next level. So they have hope instilled into the process. There's mentorship and opportunity to look ahead. We have people that have been living with us for several months that are going into our withdrawal management setting, into our detox setting, leading groups. They're talking about what good looks like, what hope looks like, where they were at. And so you'll see somebody who's 1 week ahead of you, 3 weeks ahead of you, 3 months ahead of you, 3 years ahead of you. There's this model in place that is very forward looking all the time, that gives people the opportunity to say, all right, if that person could do it, I can probably do it. And so that's really a unique model. The other thing we understand is the power of community, right? And community is where that connection happens. So not only are we all eating our meals together, staff eat meals here as well. It's part of the kind of tradition here. We serve about 3,000 meals a week at Stella Maris. We feed the staff, we feed clients, we feed alumni. So you come back, you eat with us. It's a really nice place to do that. It's typically a recovery focused conversation wherever you're sitting. And the way we bring community in is pre-pandemic, we had about 43 12-step meetings a week here on the campus of Stella Maris. We're back up to about 22. So we're doing pretty well. The pandemic shut us down to none other than Zoom. And Zoom is wonderful for this, but it's very difficult to engage in a therapeutic activity, especially connection related to stability and sobriety. So it's pretty easy to turn the camera off and to turn the computer off and be all alone, right? So that doesn't necessarily work for everybody in early recovery or long-term stable recovery. So what we do here is we have those 22 on-site meetings, which is about 800 people a week right now that are not clients on campus. So this place is alive. It's literally, it's got this pulse to it where people are just around and they're together. And because you see people at different stages, there's always somebody to talk to. There's always hope to be had in conversation with others and connection. It might be a job opportunity, right? It might be a sponsee opportunity. It might be a volunteer opportunity. A lot of people in recovery are looking for ways to give back, and they have access to that in real time here. And that happens in our coffee shop. And a lot of people have been to the coffee shop on this call. This coffee shop has been around for decades, not the way it looks right now. It started in the back of a garage, a two-door garage. I imagine it was just a coffee pot back then and a space for chairs for people to sit down and do an AA meeting. But coffee has been a part of the 12-step tradition for as long as the 12-step tradition has been around. And so in that old garage, that's where they repaired all the appliances that supported Stella Maris up until the early 90s when they started taking insurance. So what we did during the pandemic was take it back over from being volunteer-led. And we renovated the space. We made it a place where recovery and community can come together. It's open to everybody. So please, everyone, come visit us. It's got a 120-seat auditorium on the back. Bridge Builders, Cleveland Leadership Institute, they've been able to come visit. Leadership Cleveland was there. It's a place where we just want a community to be. You don't know whether the person sitting next to you is 24 hours clean. They're likely still up in detox if they are. Or whether they're 5 years into recovery, or they're not in recovery at all and don't have an issue with drugs or alcohol. It's a place people come to remotely work. It's a place people have sponsee meetings. We just invite everybody in because that's how we address stigma, is we create community and we have conversation. When people come in, a lot of times we're telling them what Stella Maris is because they still don't know who we are. And we've been there for 74 years. I tell people very often we're like the oldest adolescent that you'll ever meet because people just didn't know about us. And there was this anonymity, right, that goes along with the AA community that we're really trying to break through and say, hey, we're here. We do great work. We've been doing great work, but it takes all of us together to know that it's here and that it matters and that it's accessible. So continuing to build on our plan for access and inclusion is a huge piece of what we do. So not only do we make sure that our front door is safe for everybody, safety is the thread through which we conceptualize care. And that is safety for every community. We work in partnership with the LGBT Center to make sure that our front door, our treatment modalities, all the way through our housing are safe for all. And what that means is being very intentional about the way we create space, the way we have dialogue, the way we take care of people and set people up to choose the care that they receive. We call it an all-gender withdrawal management or all-gender detox because it truly is. We take care of a significant trans population at Stella Maris, which has just happened over the last few years. We're really proud of that work. And we make sure that people have the resources to thrive in early recovery and create some long-term stable recovery. The residential program that we're going to be creating that we're opening in Tremont is going to be a 35-bed all-gender residential treatment program. It's going to be the first one in the region that has non-binary beds. It's going to have curriculum steeped in DEI work as well. So, I think we tend to be a bit more progressive than some other community behavioral health organizations because we know it's how people find safety and access. And until we start reaching into every corner of this community, we're not going to thrive as well as we could or should or deserve to. And at the front of all of it is just making sure there's dignity for everybody in the process. So couldn't do that without our partners throughout the community. I see Rick on here. May Dugan is a great partner. They do amazing work. There's just so many on here that do neat stuff. And so if there's a way that y'all have to partner with Stella Maris, work together with all these entities, we're only, as strong a community provider as we are working with the other community providers. So I invite you all to please come to the coffee shop, come see what's happening, come tour the campus, walk the space. Really, we are just appreciative to be here, being able to do the work. And I thank you all for listening. And if you want any information on Stella Maris, please, I'll make sure my email is available. Reach out to me, come out, visit, tour. But thank you all for your time. I'm really happy to have spent this time with you.
Well, Daniel, thank you so much for sharing about the work that you all do. And we have had a few questions come in. So let's start with the pandemic. Have you had issues retaining staff, particularly clinicians?
No issue at all. Yeah, absolutely. I think just like every other industry, we've struggled. Clinicians, in particular, it's really, for us, it's about an internal growth model, right? So when I got here a few years ago, this just being where we are and where we've been and how we've evolved, we had this cost of living increase every year that people just got the same amount. We had to move to a merit-based system. And we did that pre-pandemic, which was a hard transition for a lot of people, but it helped those that are superstars or doing great work be seen and rewarded for that work, and then have an internal growth model for having a path, a developmental path for people internally where they could see a path forward and they don't have to look outside of these four walls for their next career opportunity. And the leadership here need to be having those conversations routinely. We have had to benchmark pay many times in the last 3 years, right? So we let our staff know that we're doing that too. So we published, and we'd be happy to share this with anybody. We published a compensation philosophy. How do we determine how we compensate any professional here, any person here, not just professional, from a cook all the way to an executive? It's understanding how we conceptualize the rate that we believe is commensurate with the role. So, and it's not a perfect science. We're always looking for more. I mean, I think what we really need to do was add HR infrastructure, which we didn't have 3 years ago. We've got a great HR director now. So that was really a game changer for us.
And you mentioned that there is the ability to access services regardless of ability to pay. What are your funding models in order to be able to offer the services regardless of ability to pay?
A few different options. We're about 70% of our payer mix is Medicaid. What we're really good at and where we have a partner in Metro Health is Medicaid enrollment. And that's been a transformational for us. So people can go through our withdrawal management, hopefully be on Medicaid by the end of that if they don't come in on Medicaid. And then we have the contracts with a few different county boards, drug and alcohol boards, which helps. Most of our clients come from Cuyahoga or Lorain County. But in that 5-county region, there's a Northeast Ohio collaborative that helps pay for some treatment. There's a few different opportunities related to that. But at the end of the day, for instance, we have had some refugees come in, and we're going to take care of them if we have an open bed. It doesn't matter if we have a funding source. So that's where at the back end, it takes us having strategic philanthropic relationships to say, please help us on an annual basis to make sure that we can hold true to our mission and take care of anybody that hits the door. So it's really a combination. We're really successful at getting people on Medicaid and enrolled, being able to gap fill with some county board funding, but then also making sure that our relationships with the philanthropic community are strong and the foundational community are strong so that we can maintain our mission.
What are some of the misperceptions you encounter around substance abuse and accessing treatment, and how do you work to combat those misperceptions?
Well, I think first it's that it's not that bad, right? Like very often, most people that are in relation to somebody struggling see it as their situation, right? That it's their thing to deal with. And when they decide that they'll get well or they never want to get well, sometimes it just takes a different conversation and getting resources and education. I think it's really where we have the most change and hope is related to the stigma associated with it being an issue of willpower and not a disease, right? The conversation about it being a disease. I worked with a medical director before I came here who said, if you live on the street with somebody who's got cancer, everyone's bringing them a casserole. When's the last time anyone brought a casserole to a family that had a child struggling with addiction? And that's kind of at the foundational core of understanding how we conceptualize addiction and mental health issues. We believe it's a moral failing most often, and that there is choice, right? You choose to get cancer. No, yes, there is choice involved in chronic use. But the disease of addiction is pervasive and hijacks the decision-making system of the brain and prefers things despite knowledge of healthy choice and consequence that choosing is going to be hijacked. And until we can have the conversation about, how do we support those struggling with that rather than shame or jail those struggling with that and try to isolate them, it's kind of the old institutional models we used to have where medications were not made for the people struggling with mental health issues. They were made for everybody else to deal with those people, right? To just numb them out. It's the same model. It's saying, how can we integrate them into our community? How can we have neurodivergent people in our population and say they're a part of this? That's really where the innovation and change and collaboration has to happen.
And since your time joining the organization in 2019, what have you been the most proud of? What success stories really stand out to you?
I love that we launched an LGBTQ plus track across all the levels of care, and to see it actually be impactful. We actually presented at the opioid conference earlier this week on the LGBT program, and to see things that we started just in like a back office saying, hey, what if we did this? And what if we were good at it? Like, how could we be good at this? To see it like a presentation we were giving in front of other clinicians and people appreciating and learning from it. I had just very proud moments related to those presentations. We also did one on the interdisciplinary approach to ASAM criteria, which is the American Society of Addiction Medicine, and placing clients properly at the right level of care. Building the building, the 13,000, what I did know how to do before I got here was build detoxes. And so building that here in a community that very often doesn't necessarily believe that they're deserving of nice spaces, or that it's going to be a place worth being in. We built a detox that they didn't have to think about where they were, so they could focus on what work needed to be done. And I think that's something that I'm incredibly proud of, because dignity was at the forefront of the building as much as it is at the forefront of the programming.
And as you start to look ahead the next 5 to 10 years, what's your vision for the organization and where you all are headed?
Well, we got a lot of development happening, right? Just the community in general. It's an exciting time to be in the city. It's an exciting time to be in the county and the region. But there's also fear associated with that for us, right? We're right in the heart of Ohio City and the West Flats, which is slated for a lot of development. You know, we're neighbors with Lakeview Terrace, which, if you look at what's happening with Woodhill, there's that mixed use development that's going to be coming, a mixed income development. You know, we built a pretty detox so that we didn't stand out in the middle of this neighborhood that's rapidly changing. So one, we're trying to solidify our footprint, making some additional real estate purchases to make sure that we don't just take care of the community, but we help the community thrive by the work that we do in wraparound. So we do extensive trauma services. We're doing equine therapy, art, yoga, but making sure that people understand the workforce development access. So we have culinary programming, a barista training program, making sure that there's access to things that are going to help you launch into productive, intentional living. So acquiring additional real estate, I think, will help us solidify that footprint. Our clients deserve green space, which is hard to find in this specific neighborhood. And so making sure that as the Irishtown Bend evolves, which is only like, you know, a 2-minute walk from here, it's going to be amazing. We want to change with that and make sure that we're fitting in with that aesthetic. So making sure there's green space for exercise, which is a huge part of recovery for a lot of people. And then more housing, because we need housing to make sure people can access care. If we do not have enough housing, people can't get well. So we need to find funding mechanisms to take care of housing for everybody in our community, right? For Stella Maris specifically, we need to do better outreach into the east side of Cleveland. Historically, there's been disinvestment from the addiction treatment community, especially the well-funded addiction treatment nonprofits, into the east side of Cleveland. So we want to partner with people like Providence House and Care Alliance and make sure that we are over in all the neighborhoods, that we're in Woodhill, that we're in Midtown, that we're in the Huff neighborhood, that we are present and accessible. And when they come here, they see people that look like them, and they see safety in our setting. That's incredibly important, and not just in our setting, on our leadership team and on our board. And then finally, I think we have a benzodiazepine crisis coming. I think we're kind of already there. We've been talking about the opioid epidemic. So what Stella Maris is really doing is ramping up our conceptualization of how we're going to take care of generations of emotionally dysregulated people related to the pandemic anxiety. So we assume in the next 5 to 10 years, as those teenagers that missed out on so much hit adulthood and had been prescribed benzodiazepines for long periods of time and have brains steeped in benzodiazepines. We need a withdrawal management curriculum that's not only going to cater to young adults appropriately, but older adults that have struggled with dysregulation, chronic emotional dysregulation resulting in benzodiazepine dependence. So that's where we are making sure we create access for that community as well, because we see it coming in a tidal wave.
Well, Daniel, we thank you for joining us and sharing this such important work of Stella Maris and all that you are doing to make a difference in our community. And we will be sure to send your website in our follow-up email and encourage everyone on the call. If you want to learn more, please reach out, visit the coffee shop. It's a wonderful space, and please spread the message of Stella Maris in our community because they are doing some really amazing work.
Thank you so much.